may be more widespread than previously thought. They say more than 40% of people with the virus are asymptomatic. Joining us now to discuss are epidemiologist and senior fellow at the Federation of American Scientists, Dr. Eric Feigelding, and former White House physician, Dr. Ronny Jackson. So, Dr. Feigelding, let me ask you, does that mean that we're going to see this spread even more than we expect?
Yeah, with 40% asymptomatic and 60% in some cases on an aircraft carrier, Navy aircraft carrier, I think it's really worrisome because these people have no symptoms and will likely, engage in going out into parties or not be careful wearing masks. And it also just reinforces why masks are so needed. But that many asymptomatic carriers means there is a lot of virus floating around. And just testing those with the symptoms is not going to be enough.
Dr. Jackson, it seems like we hear different statistics every day just regarding cases, how many are asymptomatic. It gets a little confusing. I mean, what are you feeling as far as what you're experiencing? And do you feel like these numbers are way off, or what is your take on this?
Well, I've been saying basically since the beginning of this that I think that two things are going to happen. It's going to be a lot more widespread than we initially thought it was, and that's proving to be true. And that as such, the mortality rate is going to be a lot lower than we initially thought it was going to be, which is also proven to be true. Now, I agree with the comments that were just made, but I also say that there's some good news on the horizon. If actually that many people are getting it, we don't know about it, that does mean that in certain populations, we are developing a certain level of potentially, or getting to the point where we develop some herd immunity that wouldn't otherwise be there. So I think that, if this rolls back into the fall, and, we already have a large number of people that have had it, that were asymptomatic, that didn't know they had it. Those are people that are going to provide a little bit of herd immunity for the others out there that haven't had it. And I think that, that just also reinforces that we really, really have to look at those special populations, the elderly and those with pre-existing conditions. We have to make sure that they're well protected because they are still being exposed whether we know it or not.
Dr. Jackson, let me ask you about all the developments out there. There are companies out there getting money from the government. There are companies out there getting some headlines. Their stocks are going up. They get excited. We think they're going to. What gets your attention as far as developing either a treatment or a vaccine?
Well, there's no one particular one that's caught my attention. I think, some of the ones with the most press recently have been remdesivir and hydroxychloroquine and things of that nature, and some of the vaccines that are out there. But I think what gets my attention is that, hopefully people, companies aren't taking financial advantage of this crisis and driving up their stock prices and stuff. We don't want to see that happen. But what this tells us is that there is a large push in the private sector out there to find the drug that's going to be the silver bullet for this. And I think the fact that there's so much money being dumped into this right now, I think that it's very promising that we're going to find that with regards to both a medication that might be used to treat this and potentially a vaccine that we can develop much more quickly than we normally would.
That's encouraging. That's what we need. We know that. Now, Dr. Feigelding, circling back to those who are asymptomatic in regard to the study and the data that you've seen, are you finding any common threads among those who are asymptomatic? Are more of them younger, more female? What do you know?
It seems the asymptomatic tends to be younger and healthier. And in certain ways, it's good, but in certain ways, it's actually more worrisome. And again, also, more asymptomatic does not actually mean a greater seroprevalence that could help with herd immunity. And I strongly disagree with Dr. Jackson on that, because herd immunity, you need at minimum 60%, but ultimately 75, 80%. And around the country, we're sampling, for the most part, in single-digit percentage. Even in Sweden, Spain, and Italy, where they're hard hit, they're all around 5% if you sample them. And at most, 15% or so in the cities and 19% in New York City. So we're not even close to herd immunity. And those are sampling everyone in a random way, not just sampling symptomatic. So asymptomatic does not mean we're close to herd immunity whatsoever.
So I'm just curious, though, Dr. Feigelding, as you see more and more people venturing out, all 50 states are open in some capacity, what are your concerns? And do you think that people are taking this seriously enough?
I don't think people are taking it seriously enough in some segments of the population. And this virus is not political. But this virus right now has become a partisan issue when it comes to wearing masks. There's even people refusing to wear them in stores, as well as ripping them off of people who are, and that is just not okay. This masks definitely help, and we now declare that it is an airborne aerosol virus, and 6 feet is not enough, and that is clearly the evidence that we need. That just means we need masks more than ever for everyone, and again, it protects everyone if everyone wears them. So this is why it's so important, and we need to stop the partisan politics on the masks.
Dr. Eric Feigelding and Dr. Ronny Jackson, thank you so much for joining us. Coming up, we will have continuing coverage of the coronavirus crisis.